Some patients report that their urticaria lesions only appear when they feel hot. What is this?
Yeah, this is most likely one of these chronic inducible urticarias. We call it heat urticaria, where the symptoms of urticaria only occur when the skin gets warm. So you touch something warm, and where you touch something warm, the wheal will appear. It will not appear anywhere else. It will not appear when the skin does not get heated. But every time it does, you will see a wheal or even angioedema. This is a rare form, and you really have to ask, does it have something to do with touching something warm? If there's a general sense of when I get hot, when I do exercise, when I take a warm bath, when I'm in the sauna, this is what makes the wheals come, then that's probably cholinergic urticaria. It's another form of chronic inducible urticaria, possibly linked to sweating and the increase in body temperature, where every time this happens, the wheals will come, but the wheals will only come when you get hot, when you do exercise, or when you are in a warm bath. And this form of chronic inducible urticaria is quite typical in young adults, very disabling, because of course every time you do sports, every time you do exercise, you break out in hives, and that's very disabling.
Are there any underlying causes known of cholinergic urticaria?
Well, we don't know as much as we would like about cholinergic urticaria. What do we know? We know that this disease is linked to other allergies, and that's something that's infrequent in other forms of chronic urticaria. But this cholinergic urticaria, occurs more often in patients who have other allergies, atopic dermatitis, allergic rhinitis, or even asthma. So we think that it may have something to do with the ability to produce an allergic reaction. In some patients, we find that there is an allergy to sweat. So that would explain why every time you get hot, you get sweaty, you react to your sweat with this allergic reaction, this cholinergic urticaria. But there may be other underlying causes, and research projects to identify these underlying causes of cholinergic urticaria and other inducible urticarias are underway, so hopefully I'll be able to answer this question better next year.
You did not mention diets. Is there a reason?
The reason is that this doesn't have anything to do with it. We have no indication that diets or intolerance to food components has anything to do with any chronic inducible urticaria. This is something that is relevant in chronic spontaneous urticaria, but not chronic inducible urticaria. So there's no use in keeping a diet in cold urticaria, in cholinergic urticaria, in heat urticaria, or in any of the other chronic inducible